Let's begin the public square now on this station. I'm Wayne Shepard here with Dave Zanotti. The whole team is present as well. But Dave, this is going to be a very in-depth and important conversation today about Planned Parenthood.
Last week, Wayne, we talked about Caleb and Joshua, and Caleb entering the promised land saying, remember that mountain from 40 years ago where all those giants lived? That's the one I want. Well, today we are going up against giants in the reality of spiritual strongholds.
They're in the land, aren't they?
Yes, we're going to pull back the curtain on an article recently published, research done by the New York Times, which is quite surprising. And we're going to get into that in just a moment in detail, but we're also going up again against the giant of Planned Parenthood and the entire abortion industry and movement in America. So we've got our hands full. So right now, before we go any farther, I suggest as a listener, you pause and say, Holy Spirit, help me to hear this. And as we're praying, Holy Spirit, help us to present this in such a way that we can be truthful, kind, and loving. But let's not kid ourselves. We are now touching upon the forces of the Death Eaters of the modern world. These people have a philosophy, they have a worldview, they have an agenda, they have a practice, they have a methodology, they have a profit center. They're out for real business, and their real business is, in essence, in a word, it's abortion. It's the ending of the lives of innocent unborn children and amplifying that action into a form of a civil right, a human right, a right that is inalienable and untouchable by anyone, so that in essence there is no longer any sense of protection for an innocent unborn life in the United States of America. That's their ultimate goal. That's what they had under Roe versus Wade, with just a little bit of window dressing around that 50 years of fighting, the pro-life community was able to do some things to try to bring reason to the conflict, like the idea that you needed to have informed consent for a patient, that you needed to have healthcare provisions that would make certain that women going through this treacherous moment in life would not become abused. And there are many other things like that. But the essence of Roe versus Wade for 50 years was abortion through all 9 months, unrestricted for any reason, provided that the people who filled out the paperwork did it correctly. That's what we had. And interestingly enough, and this is important to remind everyone, now, just if you haven't heard this before, this is going to be coming to you as a surprise, and you're probably not going to believe it the first time through. The year after Roe versus Wade fell, there were more abortions in America than under Roe versus Wade the year before.
Unbelievable.
So this is a conflict that very few people know about because it's not being discussed. But the New York Times did something just a few days ago. They released something. They've been working at it for quite some time. They had to have, because of the number of people they say that they interviewed and even well beyond the article. They put forward an article that carries the title Botched Care and Tired Staff, Planned Parenthood in Crisis. Planned Parenthood in Crisis. Now, this is the New York Times talking. This is not a pro-life organization, a pro-life media source. This is the New York Times. Planned Parenthood in Crisis. Today, we're going to investigate that article.
Our broadcast team here includes our producer, Alan C. Duncan. Jeff Sanders is here, Melanie Elsey, and Rob Walgate. So, team, let's weigh in on this to begin.
Does it surprise anyone that Planned Parenthood is being exposed by the New York Times?
Yes. I wrote down in my notes, I said, the New York Times is admitting what we have been suspicious of, and then we had evidence of for years about the unsanitary conditions and how people have been giving the wrong treatment, the wrong medication. They got infections, botched abortions, and people got very injured.
So on one hand, it's surprising. It's surprising who it's coming from, but the information itself is not shocking to us because we've been following it for a while.
Right. Well, and I think in the manner that they're giving it inside this article, they're trying to play on the emotions in giving the stories because they're exposing it, but they're also hinting at the fact that if they had more money, none of this would be happening. So is the article an expose on Planned Parenthood, or is it in essence a fundraising pitch that says, hey, if we had the funds, none of this would be happening. These things are terrible that are happening, but it's not saying they shouldn't be happening any longer, so we should get rid of this. It almost is an appeal for sympathy by playing on the emotions for people that they agree with them in abortion.
Wayne, I see you nodding your head. You're seeing the same thing?
Yeah, but at the same time, it's been a bit of time since I read the article, but didn't it refer to the fact they have a lot of cash in reserve?
They have a lot of cash in reserve for the top of the pyramid. They don't have a lot of cash in reserve for the individual clinics.
Well, and that's why I didn't necessarily think that the article was making the case that Planned Parenthood is a great organization. I mean, maybe they did want to engender some sort of sympathy for them. But if I were to tell you that there was an organization that wouldn't allow unions, patients described they felt like they were in a factory, you can't criticize your higher-ups there, and the execs won't take pay cuts, we'd all say that sounds like a bad place to work. That's how the New York Times describes Planned Parenthood in this article.
But I think it goes back to what was the discussion prior to this article, when states are looking at constitutional amendments, when state statutes are looked at, federal statutes are looked at in terms of regulating abortion. It's primarily debated on a philosophical note. And what this article does is turn a corner to expose. I don't think it goes far enough. I think there is a whole lot more under the tip of this iceberg, that could be talked about. But this article at least cracks that door open so that we get a peek. It's just a peek.
Does anybody remember Planned Parenthood ever being under the microscope from the New York Times in recent years? I mean, we've had a lot of debates around the country about abortion. Even from 2022, we could go before that, but let's just go for the last 3 years. With all the debates that have been going on and all the statewide ballot issues that have been going on. Does anybody remember any exposés criticizing Planned Parenthood coming from the New York Times?
Never.
No, quite the opposite. I think the exposés that they have tried to do over the years is that every time a federal budget's moving through, they're trying to undo the Hyde Amendment, process that would be restricting dollars. Their practice in the past has been quite the opposite.
So the motivational question is to why now? Why would the New York Times come out and let forth this expose? And let's get a little bit more into the details of how big of an expose is it. First off, the headline is significant. Botched care and tired staff, Planned Parenthood in crisis. Okay, that's not small language.
No.
That Planned Parenthood is in crisis.
They had me at botched. Yeah.
Yeah, botched and crisis.
Yeah.
I mean, they didn't choose those words accidentally.
I'm surprised that the headline made it through. Are you?
Yeah, I am. And who, way to advertise for Planned Parenthood, because who reading that or hears that is going to go to Planned Parenthood.
Patients report failed abortions, misplaced IUDs, and inadequately trained staff. That's how it begins. And then it starts with one of those human interest personal stories that is so traditional now for opinion journalism, where they start and they tell you a story. Well, the story they tell you about is an extraordinarily difficult story. A woman who was 8 weeks pregnant with 2 children already under her care. She was a mom of 2. Her boyfriend decided to leave her. She moved her 2 children and herself into a homeless shelter and then sought an abortion because she didn't feel she could. Well, I can't speak to her motivation. She sought the abortion. More evidence is not given. The point of fact is it was a botched abortion. And 12 weeks later, she gave birth to a child who then perished quite quickly. Okay, this is how the story starts.
I can remember when the media, this was 20 years ago, when they were saying there were no botched abortions in which the fetus survived, and yet here we are now with the New York Times admitting
lead
this.
In
there
the first
it is.
couple paragraphs.
Yeah.
Right out
So
of the
I'm
gate.
surprised.
And then this particular woman, again, who will remain unnamed for protection, there's specific names in this, which we're not going to get into. She has now filed suit against Planned Parenthood for malpractice. That's how the New York Times starts the story.
Did this make you all think of those Planned Parenthood whistleblowers who came forward a few years ago and talked about the conditions, but they were summarily dismissed by the mainstream media? That was the first thing I thought about.
Including the Associated Press.
I have the email pulled up. You sent it around. I will not say the reporter's name, but this is an Associated Press reporter emailing back and forth with you during the Ohio Issue 1 abortion debate. And you sent that reporter those Planned Parenthood whistleblower videos. This reporter told you, I'm not going to watch the 15-minute video, not even a long video. It wasn't like a documentary series or something. This person said, I'm not watching the 15 minutes. And then they said, also be cautious, our misinfo team, which that's just kind of a cringe way to say misinformation. But our misinfo team has fact-checked a number of these testimonials from the internet, and not all are as they appear. Well, this New York Times piece seems to make it seem like they actually are exactly as they appear.
And they're numerous.
Yeah.
And again, we don't have exact apples and apples. We're not sure that what the reporter was looking at were the exact same people. We're not alleging that. We're talking about the environment, the atmosphere, and the dynamic of what's happening.
The kind of stuff.
With further investigation. Yes. And the New York Times is saying, well, they found it. They found the problems. So this is a blockbuster article.
And we'll continue talking about it and offer some resources as well. So stay tuned for that coming up on The Public Square.
Where else can we lay our heavy burdens? Where else can we find the help we need? Who is gonna lead us out of darkness? And who's gonna lift us off our knees? Where can we go? Where can we go? Where can we go? Where could we go? Lord, to thee. We've looked high up on the mountains. We look way across the sea. Where could we go? Lord, to thee.
We will be right back for more on The Public Square. Let's see, there's our tithe, food and clothing budget, taxes, all the insurance, and the car payments. Where's the line in your budget that helps pay the bill for fixing what's wrong in America? Log on today at aproundtable.org and join the growing team that's giving every month to get America back on track. Make your monthly contribution to aproundtable.org. Spreading the light of liberty across the land. Now back to the Public Square.
Under discussion today here on the Public Square, a New York Times article, Botched Care and Tired Staff, Planned Parenthood in Crisis. Dave?
Rob, you talked about this idea of a fundraising appeal. One of the lines directly from the New York Times article is the lack of resources is startling. Since the U.S. Supreme Court overturned Roe v. Wade in 2022, Planned Parenthood has enjoyed a fundraising boom with $498 million in donations that year. But little of it goes to the state affiliates to provide health care at clinics. Instead, under the national bylaws, the majority of the money is spent on the legal and political fight to maintain abortion rights. So it's interesting now. So is this a fundraising appeal? Is this a plea for sympathy for the nation that poor Planned Parenthood can't get its job done?
Well, it doesn't talk about policy in the article. It's a piece that's written by an author that has a background. I believe she wrote for Fortune. She worked for CNN. She has a money background. That's what her background is. And I think of, we've referenced Ohio 2023, the Issue 1 debate, as well as we can look around the country where other abortion measures have been on the ballot. Tens of millions of dollars that are poured in from outside groups on those policy measures. So I just felt like it was a tug on those purse strings to try and fund some of these affiliates that they're talking about.
Well, but if I'm reading the article and I've got a lot of money and I'm considering donating to this, I'm not thinking that the money's going to get to the clinics. Like the article lays it out, the fact that it's just going to go to the execs. They make the point that these executives are among the highest paid in the nonprofit sector.
A lot of 5 martini lunches going on there.
But what in Planned Parenthood's history would make me think that they'd actually use the money for what they're saying they're going to use it for?
I don't think this is a fundraising plea for private dollars. I think this is a fundraising plea for public dollars, because the article in pieces and parts collectively describes how the federal dollars are going for lawyers and lobbyists and highly compensated executives, investment accounts. The staff at these clinics are on Medicaid, a lot of them. That, as the article describes.
Excuse me, you said this, I'm sorry, the staff on the clinics?
The staff
are
of
on
the
Medicaid.
clinics, as described in this article,
The people that work there.
are themselves on Medicaid, and they're encouraged to take extra jobs in order to make their own ends meet personally. So you've got top-heavy dollars being disseminated. And what they're saying is not enough is filtering down to the clinics and to the employees. We need more. So I don't think it's going to affect the private dollar donations. I think those will always be there. But what they're saying is we don't have enough of the public money.
Wayne, I'd like to spend more time detailing the abusive practices that define a crisis to the New York Times. They're surly and they're challenging. They're difficult and disturbing. But we're not going to do that because we're just simply not enough time. Also, people are going to ask, well, read from the article. We'll do some of that, but they're also going to say, how can I get the article? Let me stop right now and tell you this is not an easy situation to deal with in regards to information distribution, because the New York Times is sheltered behind a very fierce paywall. If you don't have a subscription to the New York Times, you don't get access to their material. And the days are gone where you can go to the public library, get a New York Times, take it to a copy machine, put it on the copy machine, copy the article, and then send it to your friends. They don't like that. Okay, so there is a very high paywall and very high copyright challenges that we face right here. So we're going to be very careful. We have read through their materials. We are going to be very, very careful. We cannot offer a reprint of this without permission, and I can assure you that we don't get permission to do that in the context of this conversation. I really doubt it, and we don't want to waste the time to find out what we already know, which is the answer would be no. So if you want to get to the New York Times to get this, what you've got to do is either go and subscribe, or you've got to find a friend who's got the subscription who can gift it to you legally, or you got to go to the public library and go read it yourself. That's the way this is going to work. But I can assure you that the article is real. We have it right in front of us right now because we do have subscriptions to the New York Times. It's there. And part of the reason why it's released in this fashion is they can put this hit piece up on Planned Parenthood, but very few people are going to see it. Have any of you seen reprints of this article anywhere so far?
Well, a lot of times I Google the title or DuckDuckGo the title of the article, and you will either get an option for maybe a free article from the New York Times,
Free trial subscription,
or the fact someone will reprint it with permission in some places. So I would just put that in your search engine and look for it, and sometimes you can get lucky.
Well, and Dave, you sent around, or you and Rob, I forget who we were passing it around, but sent around this article from Live Action News, a pro-life organization, and they did a nice job of summarizing the New York Times piece.
And we also have a summary document that will be available at thepublicsquare.com, as well as we have information that you need to want to look at aproundtable.org. By the time we get to the end of this broadcast, we're going to help you get more resources.
Good.
The point is, this is real. It's a real article. It's a real critique. It is built upon what the Times says, interviewing over 50 people. To interview over 50 people and to do an analysis of a corporation of the size of Planned Parenthood takes serious time. So this is a piece that is worth looking into because it does tap into the reality of what's going on. Now, let me suggest we do this. Let's take a look at something this article does that is also surprising. Is real quickly we can summarize how it explains the function of Planned Parenthood. There are technically 3 Planned Parenthood organizations that share the same name or portions of the same name.
3 layers.
And they all share, well, at least two of them share the same motto, which is care no matter what. Now, that's quite ironic given the way that the New York Times writes a lengthy article on botched care and how they're failing in their very mission statement, at least their public relations side of it. The first organization is Planned Parenthood Federation of America, PPFA. That is a nonprofit 501c3 national organization where most of the money that is raised goes to. That is, their purpose there is education and research and the defense of the right of abortion in America. That's what they are. The Planned Parenthood, the New York Times calls them synonymous with the protecting of abortion rights in America, or something like that. So that's the big group where the big money comes. And Planned Parenthood Federation of America also has a second layer of their organization, which is their membership relationship with organizations in 50 states that also carry the name Planned Parenthood. That's the clinic. The clinic in each state, in each community, is a part of a state-based, independently incorporated organization that is also a nonprofit that operates taking all kinds of money from the state, from the federal government, from private contributions, from Medicare, Medicaid, and personal pay of patients that provides services. That's the medical provision side. These two organizations, PPFA and the state organizations, do not do the same thing. They rally to the same cause. They get involved in all the politics and rhetoric and debate and all of that stuff. But the Planned Parenthood Federation of America cannot provide medical services because it's not in their charter, incorporation of charter. The states is where that happens. And so you have internally in the organization between these two groups, and the states are members. They have a membership association in relationship with PPFA, but the two organizations are actually in tension against one another. There's a dysfunctionality because the work gets done at the bottom, the money comes in at the top, and the top doesn't share with the bottom because the bottom is dedicated toward services and the top can't provide services. So the New York Times does the world a favor by saying, look at the dysfunctionality in this model. And it's there and it's real. Now, there's another wing of Planned Parenthood, which will just take 10 seconds to describe, and that's the political wing. And that's Planned Parenthood Action. They do the actual electoral stuff of Planned Parenthood. And they're completely separate in regards to funding and books. However, PPFA and the political arm share the same executive directors, the same CEO. Okay, so there it is. That's their network, and it's in tension with each other. And the tension has created a funding challenge, which creating a big problem at the bottom, and the New York Times blew the whistle.
Reminds me of a business structure and a franchise and franchisees.
When we use the term industry, Wayne, we're not kidding. This truly is industry. And this is all legal. They have the right to do it this way. The point is, without using the term, the New York Times is basically calling out, blowing the whistle on the dysfunctionality of their business model. And the people that are getting hurt are the employees at Planned Parenthood and the patients.
You asked us if we were surprised by how does Planned Parenthood look at this article, do you think? Were they surprised?
I think they're really glad that the New York Times has a very high paywall.
Interesting.
I do find that somewhat darkly amusing. I'll get emails from the New York Times, and it'll be some headline that's like very important. You need to know this, and then I'll try to click on the article, and they're like, actually, you have to pay us to get to it. I'm like, so you're not a public service. That much I know. You're not a public service. You didn't want me to know it that bad.
Dave, I have a question. Do you think that this is coincidental to the process that's just starting with the appropriations bills at the federal level? Because the Hyde Amendment has to be renewed through HHS and other agencies every time there's an appropriations bill. About every year, they have to be renewed. It's a temporary section. It doesn't automatically renew.
Well, I think there's a lot of reasons this article came forward. I don't know who got the last word on it. I know that Planned Parenthood was not abundantly cooperative, according to the Times. I'm not using their exact terms, but there were comments back and forth from people that they interviewed. The head of Planned Parenthood did make a comment, or a couple of comments in the article, but this does not appear to be something that Planned Parenthood was fully engaged and revealing. This was not a moment of transparency for Planned Parenthood.
Coming up in the Public Square, we'll get into those websites and resources that Dave mentioned earlier, that and more ahead on this edition. If you joined us late and want to hear from the beginning, please go online, thepublicsquare.com, and listen there or use our smartphone app. As we continue with the Public Square today and our reaction to a New York Times article about Planned Parenthood being in crisis, let's again mention some websites, Dave. I know listeners are going to want to follow up on this, and what can we offer them?
Several websites. First off, if you're trying to find the New York Times article, we would encourage you to read it if you can gain access. Put it in your search engine and see what comes up, because it may be being republished, reprinted with permission by other news services. We do not have that authority, and we are not going to request that authority from the New York Times because it just takes too long. And, well, there's a lot of reasons behind all that.
Sure.
If you know somebody that is a New York Times subscriber, we are. Don't call us because you're only limited to a certain number. We can't help you. Find a friend who's got a Times, and they can gift this article to you online.
Legally.
Legally. And so that can be done as far as that. Or you go to the public library and you get the actual print copy and look at it for yourself. That's what paywalls are about. In addition to that, when you put an article that this is controversial behind a paywall, you're publishing it, but sort of not really. It's very limited in its ability to reach the marketplace. So that's not without intention or design. Now, to reach the materials that we're talking about, our review, other reviews of this article that can be helpful to you, please visit us at thepublicsquare.com. And then and also to get our publication, Abortion in America. All right, quick test. All right. Rob, what website do they go to?
Life.aproundtable.org.
Nice job. Life.aproundtable.org. You're saying you guys got a lot of different websites. Yes, we do. All right. To make it as easy as possible on everybody but us that has to remember them on demand. Life@aproundtable.org will get you our publication, Abortion in America, and our analysis of this document will be connected to that article. So you'll have an opportunity to see the entirety of our work at Abortion in America, that publication that came out a year ago, and then the update on this one.
I'm going to give Rob an A and you a B, Dave, because it's life.aproundtable.org. Okay?
I get an F. I flunked.
Thank you, Wayne. Rob was whispering to me. He said it wrong. And I said,
and you'll notice they could have edited that, but for the whole world to know. No, they caught me.
Now we're leaving it.
Okay. All right. Okay. So what is that website again, Wayne? One more time. aproundtable.org. Okay.
Let me check with Rob. I got it correct, didn't I, Rob? Okay. All right. Good. Thumbs up.
You get an A, teacher. You get an A.
Okay.
And one more word of appreciation. None of these publications, none of this research, this conversation would not be happening if it wasn't for the fact there are thousands of people who care about life in America. And together, we all give money to be able to do this stuff. And thank you. Thank you very much for speaking out for the unborn and for the innocent lives lost and for moms in America. Thank you.
It is making a difference. All right. In the article in the New York Times, there was another specific case that was discussed. Can we get into that?
Yeah, there's a picture in the article of a door clearly in a medical facility, and there's all kinds of blue bags pressed up against the door and towels. And you go, what in the world is that? Well, the New York Times decided to tell the story at an abortion clinic, a Planned Parenthood clinic in Omaha, Nebraska. They had a toilet backup, and for 2 days, they couldn't fix the problem. Thus, the human waste was leaking out into the clinic room, and they were trying to stop the leak because the smell alone was causing people to vomit in this clinic. Now, I didn't make this up. The New York Times, with a picture, put it in their article talking about what's life like in a Planned Parenthood clinic.
Where is the county health department shutting this operation down instantly, if this was anybody else's business, if this was a restaurant, if this was a distribution center, if this was a factory, they would have been in there, Johnny on the spot, and they would have been shutting that thing down. Why did Planned Parenthood get the pass?
That's the question that goes not only unanswered in this article, but unasked in this article. And that has the creepy echo of the Gosnell story.
Exactly what I was
right,
thinking.
Melanie, on how the state of Pennsylvania
ignored
failed.
what was happening in that clinic in Philadelphia. It was horrendous.
I don't think that the article leaves that completely unanswered. The last two lines say, some have worried that criticizing practices in the clinics could empower the anti-abortion movement at a time when the organization faces more challenges than ever before. So many remain quiet, afraid of damaging the mission. That's how the article ends. So I think they're kind of telling you.
But to Jeff's point, they don't bring up anything in terms of the health department related concerns. Why wasn't there an investigation?
The health department may not have known.
Yes, somebody has to blow the whistle. Yeah.
Well, it took a long time in Philadelphia. They had reports in Philadelphia.
If that was a dentist's office, if that was any other medical office, they would have shut it down that day.
The question that has to be raised is, given that these clinic violations or deficiencies or botched procedures have created a crisis in Planned Parenthood, why is it that the New York Times is the only person who knows about it? Where are the county health agencies that are required by state laws to get in and monitor all forms of medical facilities? It brings up the question, is Planned Parenthood getting a free pass? Now, we don't know if that's the case. All we know is there's all kinds of junk happening in Omaha, Nebraska. And the great irony in Omaha, Nebraska is that's the town that Warren Buffett lives in. And Warren Buffett, the mega billionaire investor, the hundreds of billions of dollars investor, is one of the major funders of the abortion industry in America. One of the biggest donors that Planned Parenthood and all the abortion affiliates have is the foundations connected to Warren Buffett and his late wife. This is happening in Warren Buffett's hometown. I mean, the Dairy Queen in his hometown is cleaner and safer than the abortion clinic.
Yeah. Well, and that also leaves me asking the question, for 2 days you had an incident like this going on with a toilet. So, we all know plumbers, and they bust their tail to make sure that everyone is in working order that calls with an emergency. So who are they calling, or what bills haven't been paid that you can't get someone to show up for 2 days to take care of something that is
good point,
this desperate?
But
how does that happen?
But from a management standpoint, you should be canceling appointments. There shouldn't be procedures when you have a situation like that.
Now, speaking of canceling appointments, another thing this article brings up is the fact that Planned Parenthood Federation of America, which is separately incorporated and has a division of their activity, which is their relationship with the state membership organizations who own the clinics. PPFA at the top is literally, and New York Times got a document validating this, literally dictating to their clinics at the bottom their appointment schedule times. They're literally saying, you're spending too much time with patients. You should only be spending 10 minutes per patient. So much so that clinics across the country told the New York Times they felt like they were in like a conveyor belt situation.
It's an industry. It's a factory.
Yeah, if the factory at the top, with the guys at the top with all the money, tell the people at the bottom who are stuffing stuff under the doors to keep the you-know-what out of the building, all right, or out of their clinic. Well, wait a second. But they're not sharing any money to fix the problem?
Now, just for clarification, the description of the 10-minute appointments were for things other than an actual abortion procedure, pap smears and, other types of pregnancy-related or female-related health care. But still, when I go into an appointment, I do not expect to be there 10 minutes or less. I'm going to have a conversation with my doctor. I'm going to have...
And the state organizations are rebelling. Right. Yeah, they're rebelling against that situation.
If a health-related procedure is scheduled, it's going to be more than the 10-minute maximum.
Bottom line is, it works great at the top where all the money is, Planned Parenthood Federation of America, where the talk and the rhetoric and the politics happens. But at the bottom, where the services are delivered, not us. The New York Times says Planned Parenthood is in crisis as it relates to their way they treat their employees and the way they provide their services and their patients. We didn't say it. The New York Times said it.
So it's not just a crisis of a revenue stream. It's a crisis of practice in how they conduct their business.
Well, and so on that point about how they treat their employees, can I read just a quick little piece from this article itself? This jumped out to me. It says scores of former employees have sued Planned Parenthood, raising complaints that include refusing to pay overtime or provide breaks, pushing out employees who needed time off to deal with injuries or newborn babies. Interesting. And firing people who complained about discrimination or clinic practices. This is every single thing that the left in this country says they care about. All those things. And this here, the left's prized possession, Planned Parenthood, is terrible at providing those types of things to their own employees. And they have settled those cases, many of those cases as well.
As you might expect, there's more to be said, and you'll hear it next on The Public Square. Stay with us.
We will be right back for more on The Public Square. Spreading the light of liberty across the land. Now back to The Public Square.
Our broadcast team here at the Public Square, Alan C. Duncan, Jeff Sanders, Melanie Elsie, Rob Walgate, Dave Zanotti, and I'm Wayne Shepard. Rob?
In reading this article, there was a quote that jumped at me. Alexis McGill Johnson, she's the president and chief executive of Planned Parenthood Federation of America, and she had said in a statement, Planned Parenthood works relentlessly to fill gaps in a broken healthcare system. Now, we've all experienced the healthcare system, and we know it's broken, and there are gaps, and there's things that can be done better. When I read that, I'm like, what is Planned Parenthood doing and offering that is filling in the gaps of the American healthcare system? I think when you hear their name or what they're talked about or what they do, they're more of a political organization than they are a healthcare system or filling in gaps of a broken healthcare system. That jumped at me as straight from a fundraising perspective.
Yeah, there's a ping pong match going on in this entire article about they have no money so they can't provide care, but they're great care providers and they care more than anybody else. And that particular comment is pure, it sounds like pure deflection to blame the problem on the healthcare system. But when you track it down and ask yourself, well, where's the problem? Once you get into the fine points and details, you know what? Look, if you can't provide services in the model that you've built, why are you offering them? And why are state, county agencies permitting this crisis to go on without attention and care on behalf of the women who are patients there? Now, the challenge in all of this is the construct of Planned Parenthood is all the money goes in at the top where services are not provided. And then the locals have to raise most of their money in the state level with some help from the nationals. And the same executives from Planned Parenthood did say that they were considering looking at a reprioritization and sharing more money from the top out of their $332 million of retained assets. Okay. But the conflict is structural. It's a problem of the way that they put the thing together, and it's not working. And over the last 50 years, here's the great irony. They had abortion on demand for any reason through all 9 months of pregnancy for 50 years under Roe versus Wade, which meant they were the service provider in that environment where there was virtually no holds barred on what they could do. Now Roe versus Wade fell. And you would think, well, okay, they failed. The guys at the top who had all the money, they failed. They lost their protection under Roe versus Wade. But the reality is when the issue moved back to the states, it netted out more abortions, not less. They clearly weren't ready for that.
Dave, can we turn a corner and talk about what the article does not talk about?
Sure.
And I think the most serious omission in the article was not discussing the abortion pills and the pill mills that are available to women, because Planned Parenthood could scoot away from their in-clinic service negligent practices as described in the article and they could move into telehealth, where they don't even meet the woman in person, to be able to prescribe and have her use 2-tiered, 3-tiered pills, in terms of administrating the pills to the women. And women have been reported to have been losing their lives recently because of not having that doctor in person.
Complications due to use of those pills.
Right.
Yeah.
Right.
Now, everyone's shaking their head. Everyone saw the same thing. The biggest change in the abortion industry in 150 years, or at least the last 50 years, is the pills. 60% of abortions are now done by chemical abortion through these pills. Now, if you want to know where we're getting this information, get a copy of Abortion in America. We have the statistics and all of that information right there. We know these numbers are real, and they come to us from sources in the abortion industry. 60% of abortions are being done chemically. It's not even mentioned. We're talking about an analysis of the entire failed model of Planned Parenthood, botched and in crisis, and they don't bring in the single biggest change factor that's happening right now in their business. Why isn't that in the article?
That would be a great expose for the New York Times to go after, because when you think of some of the things that have happened in the, some of the unfortunate stories where people have died from abortions, and you understand that it's the pills and what happens to the body in that process. I don't think the general public understands what's really going on there, or take a look behind the scenes. The New York Times should dive into that aspect of it, because
they didn't help anybody learn anything on that.
Shine, I think of the movie The Lion King. You talk about the stuff the light doesn't touch. Don't go there. That's what I feel like this is. No one wants to go to where the light, no one's putting a light on that and explaining what really happens when in regards to the medication and the chemical and the pills.
I want to be careful to make sure everyone understands we're not talking about Planned Parenthood being the source of any of those deaths, because they're individual cases, and this is not a part of the article. So don't misread that. But
Correct.
The fact of those deaths has been well documented across the country in multiple media resources due to the complications of the chemical pills.
But what it does speak to is that this article is just the tip of the iceberg in terms of the concerns with the industry in general. And we do not, and I know this from experience, we do not have to have permission from the New York Times to share their article with legislators, because we have a constitutional right to redress, to approach our legislators on policy questions and give them information that would help them make decisions that would be consequential on this issue.
So we're going to get to that in just a moment. We want to talk about what is the response. Now, a lot of times in the current debate that we're in regards to the question of protecting innocent human life, the answers are not legislative. The answers are intimately personal, and they're choices that are being made. And there is the outreach to help women in crisis, in a crisis pregnancy, to be able to walk through that crisis and give birth to that unborn child, whether they choose to raise that child or give someone an opportunity through adoption to raise that child for them. There's all sorts of options. What we're trying to amplify in our approach is an understanding of how to help women through this moment of crisis, so that, in essence, in enduring the pregnancy, there is a human life that's brought to this earth for good. And in essence, it's a win-win situation. We're trying to move into that protection of motherhood, protection of the woman, and as well as protection of life. We get all that. And that's not something that you fix with a law. So what we're seeing today is not remedied by law, but it is very insightful in regards to what's happening to women inside these clinics, coming to us through the New York Times. So what remedies, first off, read the article, that's clear. First off, pray. Secondly, read the article. Then third, pray again. Now, what kind of remedies do you all see available to people listening to this program? Where would they start if they wanted to tell somebody and do something? Where would we start?
I personally would start with conversations with my local crisis pregnancy center to make sure they were fully informed, so that as they're counseling women who are choosing to walk through their doors, they can give them a dose of reality as to what is on the other side of the equation for them. if they're not going to choose life.
Yeah, my wife works at a crisis pregnancy center, so guess where this article is going?
Mm-hmm.
Straight to her.
You know, I would share this broadcast with everyone I know that is talking about this issue. It impacts all of us. I also would visit life.aproundtable.org and share Abortion in America with all those folks, because there's many people that are just getting the mainstream media side, or they're just getting the emotional story side, and they need to dig deeper and see some of the facts and the numbers behind it and understand what reality is.
I also think this would help conversations on social media, because when you're talking with friends or family or people in your network that are on the other side of the life issue, this is something that you can point to say, hey, the cover's been pulled back a little bit. You need to encourage people to get to that article and read it.
Yep, all good ideas. And let me build on what Rob said. We are not behind a paywall with this broadcast. You can listen anytime, anywhere you are, by downloading the free app, The Public Square, or going online to thepublicsquare.com. Some of you have to leave us at this time. Please use that website or smartphone app to listen to the rest of our broadcast.
We will be right back for more on The Public Square.
So, we've talked about this article in the New York Times, Planned Parenthood in Crisis. What is our response? What do we do, Dave?
Well, again, Wayne, I just want to reiterate, pray, pray, pray. Why? Because we're up against two of the biggest strongholds in the Western world, in the New York Times and the abortion industry and their affiliated relationship with Big Pharma. This is a big deal. And this is a spiritual battle. And so we need to pray. And we just need to pray and then listen to what God tells us to do, particularly in regards to the tone of our responses and the way that we talk about this. Yes, there's a certain attitude of outrage or shock and outrage, but the New York Times is shocked and outraged about this. Just read the article and you'll see it. So there's a certain amount of, can you believe this? But now that we know, let's pray and try to get our attitude straight. And then let's continue to talk about, you can't just pray on this and do nothing. You got to do something.
I'm reminded of Romans 12:21, right? Be not overcome by evil, but overcome evil by doing good. And I believe you preached a sermon on that, DZ. I remember a while ago going, you and I last week.
Long time ago.
We were sharing some emails going down memory lane on some things over the past 22 years, the places we've been together and the things that we've seen. But I remember that, expose, overcome, resist, right? Do I have the order correct?
And today we're exposing, well, actually the New York Times beat it to us. We're echoing the Times exposure of evil. And so you expose it, you resist it. In this conversation, we're talking about that, resisting it in the spiritual realm. And now how do you go out and resist it and ultimately overcome it? Overcoming it is ultimately loving women.
Yeah.
Godly love, godly motherhood, godly care, godly appreciation for children. Overcoming evil by doing good is protecting the lives of mothers and their babies. So that's where we've got to ultimately get to. But on this resistance side, there are people that are staggering off to slaughter. See Proverbs chapter 24. Right now, going into these clinics and hitting circumstances that the New York Times calls crisis and botched. Now, we need to turn the lights on that. Now, how can we resist? My suggestion would be find out who your county health department is. And ask them, have they seen this article?
Dave, that's one of two policy questions that I would have, that individuals in all 50 states can work with their state legislators. On the health department inspections, I think there needs to be an examination of the health department statutes related to the inspections of these clinics, if there even are any. I'm assuming most states have them. And there can be a revision to those statutes that would require those health inspections to be made public. So the public would automatically get the reports, the detailed reports of what those inspections yield. Secondly, there's a disturbing piece in the article that they briefly mentioned, and it really bothers me because they were talking about children who are under the age of 13 who would come in for abortion services because of rape or incest. Those are crimes. So there needs to be a health policy and state law that really targets on the reporting of those crimes so that you're not sending those children back into the same home or the same environment that they're going to continue to be abused.
So it would seem to make a lot of sense in the exposing of this crisis to make sure that state lawmakers, my state lawmaker, has read this article. Now, I will promise you that there's no state legislator, state rep or senator or member of the United States Congress that doesn't have access to the New York Times. All we have to do is contact them and said, have you read this article? Will someone from your staff please call me back and assure me that my representative has read this article and your office is informed of what's happening on the ground across America and putting women's lives at risk. Use whatever terms you feel. It isn't a demand for anything. It's an asking a question. Have you read this? Now, to make it simple, go to aproundtable.org. Yeah, that's another one of our websites. All right. Go to aproundtable.org and simply scroll down to Find My Elected Officials. You will find a system set up. Rob, you and Anna did a great job, and some of our other affiliates that have worked with us and good companies to put together a simple system that when you go there, you can make contact with your state representative, your state senator, and your members of Congress. Now, we have no control whether or not all the links work past there, but I can assure you from working through it that if you start there and you just put a little bit of time to it, you will be able to get information. Mostly, you'll be able to get a web or an email address and a phone number where you can call and simply ask that question, and you'll surely be able to send a letter. Though I recommend email and phone calls. All right, and the question you're asking is, have you seen this article?
In many elected officials in today's age are active on social media. That may be another place where you can communicate with them and ask a question in a direct fashion, in a polite manner. We're not going to come at them screaming and yelling. We're going to ask a question in a polite manner, and they may have an interaction with you. And then that would be to the benefit of everyone publicly as well. They would be able to see that.
Yeah, that's the point. It not only communicates to the official, it communicates to everybody else who sees that wall as well.
When we talk to these representatives, we need to make sure that we're not saying, please fund Planned Parenthood more. Like, that's not the point of what we're saying. So that's not the takeaway.
You know what, though? That's a great point, Alan. And some representatives will go ahead and take this article and do that. They'll fall into it and saying, and it's difficult. And so I think you have to discern what your odds are with your own state lawmaker in that regard. I would say, though, that even if your state lawmaker or your federal member of Congress is clearly in the Planned Parenthood camp, we better make sure they see this. We better because you never know where the seed of conscience is going to go. And this is a question of conscience.
Well, I agree. I'm thinking about my state rep. They would be in the camp of Planned Parenthood where I live. So I think when I reach out, I can highlight some of the things that I know this person would care about.
I would be curious, and I would really appreciate if a few of our listeners would relay back to us that interaction. What was the response back from your state legislator?
Yeah. Great idea. Yeah.
Now, let me kind of put a wrap on this because we're talking about taking up a big mountain and a lot of giants up there. You know, first off, with God, all things are possible.
Right.
And please understand that we are not suggesting that by bringing this up, we become the holy people. That's not what this is about. This is not about any human sense of righteousness. This is about people who are asking questions about love of neighbor. That's where we're coming from on this question, number one. Number two, you know, Wayne, there are enough people that listen to this broadcast that if everybody whose conscience is touched by this asks, who do I know that can help? There is no end to the possibility. We may have people listening right now that have direct access into county health departments, direct access into state and Senate leadership, direct access into the White House. You don't know who's listening. The key is, can we get everybody to read the article? Now, we've provided commentary on this article as well at life.aproundtable.org. Get every asset and share it. One other thought. Doesn't this sound again like a moment where people that are concerned about litigation, about lawsuits, where are the personal injury attorneys? I ask it again. We all see their telephone numbers and their ads everywhere across America. Where are pro-life personal injury attorneys? Where are pro-life attorneys that would be willing to take on personal injury cases? Where are these people able to go, these women in crisis, to get help? Who do you know?
I think we all know what we need to do now. Pray about it, and I think you'll know too. Thanks for listening to The Public Square from the American Policy Roundtable. Again, aproundtable.org, thepublicsquare.com.
Who will speak up for those little ones, helpless and half abandoned? They've got a right to choose life they don't want to lose. I've got to speak up, won't you? I've got to speak up, won't you?
The Public Square is a broadcast service of the American Policy Roundtable.